Today we have Janice Aki, the Dean of Health and Wellness and Human Services at Lakeland College, and she is here to tell us today about the new stuff coming to the Healthcare Aid Program for 2022-2023. So thank you so much for being with us today, Janice.
Thank you for having me. Pleasure to be here.
What kind of expansions have you guys been making and are planning on making to the Healthcare Aid Program that you guys are going to be offering for 2022-2023?
So healthcare aid is certainly a field that's growing in our region and throughout Alberta. So to respond to the need for more healthcare aides, we are hoping to expand healthcare aid programming with a variety of delivery models. So for the past several years, we've had a blended delivery model for our healthcare aid program where students would complete their studies in a blended format, theory at home online, and then they'd come to campus for labs, and then practicums in their home communities. What we're looking to do in 2022-2023 is give students the option to enroll in the program full-time on campus if they so choose. We'll continue with a blended delivery in Lloydminster, and we're also offering a blended cohort in Wainwright. So we're partnering with the town of Wainwright and the Wainwright Health Center to be able to give students in that region an opportunity to study at home and then come to the Wainwright Health Center for labs on weekends and do their clinical placements within the town of Wainwright.
And so with these new ways of delivering the program, are you guys expecting and planning on having more applicants and more students in the program?
We sure hope so. We did receive some funding from the Alberta government to expand enrollments, and over the next 3 years, our plan is to expand enrollments by upwards of 100 students. So with each cohort we're looking at for 2022-2023, we're hoping to have about 48 students that are completing the healthcare aid program, and we're going to look to increase that incrementally over the next 3 years.
So now that you guys have been offering this program blended for a while, have you guys been making any more new improvements that you're planning on offering with the blended online and in-person programming for the healthcare aid program?
We're always looking to improve the program. I think that the first step of that is to allow options for students for delivery method. We've seen a little change in the demographic of student, and more high school graduates are attracted to the program. I think a high school graduate may be more attracted to an on-campus delivery, which is why we're moving that to that delivery mode in September. Again, I think everyone is realizing the need for healthcare professionals and expanding into communities so that students can stay at home and study and not have to travel is certainly something that we're open to, and we see potential for that to happen in the future.